This recording is going to cover the uterine cycle. Now, the hormones produced during the ovarian cycle are going to be what's involved in the changes within the endometrial lining of the uterus. Now, remember, the uterus has three layers to it. It has the endometrium, which is the innermost, which changes through the female reproductive cycle. You have the smooth muscle called the myometrium, which is the thickest layer, and then you have the outer perimetrium. So in the uterine cycle, we're going to, again, assume a typical 28-day cycle. The uterine cycle is broken up into three components. So the first one is menses, or the menstrual phase. You can say menses or menstrual phase. The second one is the proliferative phase. And the last part is called the secretory phase. Now, the endometrium has two layers. It has the stratum basalis, this basal layer, and it has the stratum functionalis. It's the stratum functionalis which undergoes those changes in the female reproductive cycle, where you see it's increasing in thickness, and it's the layer that sheds off during the menstrual phase. The basal layer stays relatively the same, but that's actually providing the stem cells so we can replenish that endometrial wall. Now, what you'll notice during this phase, or these, and we'll talk about it again when we talk about hormones, but you'll notice that in the first 14 days of the female reproductive cycle, you see a lot more estrogen. And actually, the estrogen levels you see much greater right over in here. And I'm just going to give you a little hint, even though we're going to talk about it again, is that's when that oocyte and those follicular cells are really developing. You're producing tons and tons of estrogens. Now, the latter part of the uterine, or the female reproductive cycle, I should say, is you'll see a lot more progesterone. So that progesterone, literally think pro for gestation. That's assuming you've become pregnant, is these are going to cause changes in the endometrial wall. In other places, we'll talk about the role in the breast, but it's assuming you've become pregnant. We want to make the endometrial wall just the right environment for implantation. Now, so we're going to start with the menstrual phase, which corresponds to day 0. That's when you start your period. And typically 0 to 5, but it could be up to 7. So I have on here, but from 0 to 5 is the menstrual phase, or menses. This is where the endometrial wall detaches, sloughs off. This is because there has been a lack of ovarian hormones, and without those, the blood vessels that supply the endometrium constrict, and without blood flow, those cells die. And the reason why there's a lack of hormones is because the egg did not become fertilized. And so I'm going to just use this picture, actually not that picture, because this is pregnant. If the egg doesn't become fertilized, that corpus luteum won't remain viable. It degenerates, and then the levels of both estrogen and progesterone drop. Well, what happens is, I'm going to show you what happens is if you have fertilization, and then I'll come back and talk about what you need to fill in your notes, is we'll assume there's fertilization, and what you're seeing here is the result of a number of mitotic divisions that has taken place once the DNA from the sperm and the egg have united. You have a zygote, and you have these multiple mitotic divisions, and this has been taking place as it's moving down the fallopian tube. And what you have here is called the blastocyst. Well, this little part here is what's going to become the baby. And that area here is what's going to implant. And what we'll have is these cells here, of what we refer to the trophoblast, is what's going to produce something called HCG, or human chorionic gonadotropin. I'll write it out for you. Human chorionic gonadotropin. These cells eventually also going to be part of the placenta. The placenta is going to be an important endocrine organ. Once it's developed, that's going to keep producing all the hormones that the female needs to kind of keep that baby developing or keep that uterus the right environment for it. But what HCG does, which is on this graph right here, is HCG mimics LH. So what it will do is it will do what LH does. So it's going to keep that corpus luteum viable, producing all those progesterone and the estrogen to keep the uterus in the right environment for implantation and development of the fetus, or the embryo first and then the fetus. Because luteinizing hormone levels are going to start to drop down because of negative feedback inhibition. Is the progesterone levels, the estrogen levels are getting high, you're going to start decreasing LH. And if you don't have enough LH, the corpus luteum will die off. But if you have HCG around, it works just like LH. And so that keeps the corpus luteum producing the estrogen and the progesterone until the placenta can form. Now, HCG is what they measure in your blood and your urine for a pregnancy test. So high levels of it indicate you're pregnant, typically, but there are some false positives. So the corpus luteum, or the stimulation is secreted by those cells of the trophoblast is HCG. So that keeps that corpus luteum the way it's supposed to be. Now, what will happen is during that ovarian phase, which we said ovarian phase of the female reproductive cycle, which is again corresponding to this first 14 days, is what we were happen is like towards this part here is you have that follicle developing. All those cells are dividing. Those granulosa cells are producing a lot of estrogens, and you start seeing high levels of estrogens here. Well, that is responsible for building up that layer, the endometrial wall. So the thickness of the endometrium increases. New blood vessels start to be produced. Some glands start to be produced. Now, after ovulation, what you see here is what we call the secretory phase. But actually, let's go back here. So this part here was called the proliferative phase. So think about it. Why do they call it proliferative phase? Well, the endometrial layer is proliferating, so it's getting bigger. The secretory phase, which is kind of driven by progesterone, is going to cause that the glands, which you see right here, all these glands, to start to secrete. So they're secreting nutrients for the embryo when it implants, and so that's why they call it secretory. Now the endometrial wall continues to get a little bit thicker, but the progesterone is causing the increased secretory activity of those glands, hence the name secretory phase. So it's assuming we're going to have implantation. So we want the proper environment or in nutrition for the embryo once it implants. So we'll talk about this a little bit again when we talk about the link between the hormones, the ovarian cycle, and the uterine cycle in class or on another webinar.